Hello, good people watching this channel. Thank you very much for watching. Once again, my name is Henry, and today I'm super privileged to be joined by Mase. Mase is a graduate of Bachelor's in Speech and Language Therapy. I understand most of you don't know about this course, but maybe today is the perfect time to learn about this course. Thank you, Mase, for coming to be part of us.
Yes, thank you for hosting me, Sechanzi.
Yes, so people
Yeah,
who don't know you, can you maybe introduce yourself to them?
yeah. I'm called Masia Shaba. Professionally, I'm a speech language therapist and an audiologist with over 5 years of experience in this field.
Wow, you
Yeah,
look much younger than that.
truly.
Yeah, so what does it take for somebody to become a speech and language therapist?
Yeah, one of the ways to become a speech therapist, one, you must be a scientist or you must have a scientific background. For example, a diploma background in any science course, especially medical course, can help you get an admission in the bachelor's course in Uganda.
Okay.
Also, if you're from the secondary level, you must have been from a biological class to
Okay.
be able to get an admission. Also, at the same time, in Africa, interestingly, the speech therapy course is in few countries, and in East Africa, we are the only ones training on the bachelor's level,
Okay.
and we have the best course around.
Wow. By the only
Yeah.
ones, you meaning Uganda and
In East Africa,
Makerere?
yes. Actually, it is Central and East Africa.
Okay.
Yes.
So Makerere is training it in Uganda.
Yes.
Are there any other universities that are offering it as of now?
Not really, probably in the future, but as of now, it's only Makerere University.
Okay. And then which
Yeah.
other African countries have this course for now?
South Africa, Nigeria, Ghana, and maybe Egypt.
Egypt.
Yeah.
Okay, awesome. So after you finish your bachelor's, by the how many years is it?
It is 4 years.
4 years.
Yes, currently.
So when you finished that 4 years, did you get a job easily? A job's many, or it's also for struggling like some of the courses I've seen around?
When I had finished, we were very few in the country. We were about like 36. So it was a bit difficult to get the jobs, but good enough. This is a skill that can get you something to do or work to do, because you'll be referred a client who needs your services. So even if you don't have an official job that gives you a payroll, you can always get a client whom you can work with privately and be able to earn something.
Awesome,
Yeah.
awesome. That's really interesting. So you've mentioned about clients. I'm trying to imagine you're a special language therapist. So
Yes.
which kind of clients do you get? What are the people that you work on?
So actually, to go back a little bit, speech and language therapy basically is an expertise in communication and swallowing disorders. So anyone who has challenges with speaking, comprehending, or voice, or even chewing their food, or even being able to move their tongue to either feed or speak, they can benefit from speech therapy. So we see a range of patients, that is children and adults. So anyone that has any difficulty that I've mentioned before, for example, can be caused by different conditions, like in children who have autism, Down syndrome, or any other neurological condition. It can even be hearing loss, and a child receives hearing technology for them to receive sound and then later learn to be able to comprehend and learn to speak. Yeah, so the technologies include hearing aids and cochlear implants. And those also are the same that adults receive. Like, for example, adults from like war zones, or anyone that gets their cochlea suddenly maybe start malfunctioning from any injury. It can even be meningitis, you know? Yeah, so for adults especially, there are other neurological conditions which are acquired. It can be degenerative in nature. You can get a brain infarct from a stroke, an accident, or any other thing that causes the brain to stop functioning the way it was and has affected the areas that help with speaking or feeding.
Oh,
Yeah.
awesome. So looking at these services,
Mm.
they sound like they're provided by specialists, and I guess they're quite expensive. I don't know. Do they come at a fair cost, or they're expensive services to provide?
Well,
Mm.
they are a bit costly for
Mm.
one reason, because therapy is usually long term. It's
Okay.
not a one off thing that you just receive today and you're better. So
Mm.
imagine having to receive therapy for a year or two or even 4 years to actually get real results or profound results that will help you, you
Mm.
know.
Mm.
So that is why it is costly, because
Okay.
of the length of time one requires to recover.
Mm.
Yeah.
Okay.
Mm.
Awesome. So, with the experience you've had so far, 5 years, would you
Mm.
recommend somebody who is still maybe in high school, who is just joining campus, to do this course of speech and language therapy?
100% I would.
Okay.
Why?
Mm.
Like I said, you do
Mm.
not need to be a job seeker. Why?
Mm.
Because you have a skill
Mm.
that you can offer professionally. I'm a speech language therapist. Um, a speech language therapist is an expert in communication and feeding disorders. We work with a range of people, both children and adults. So, anyone that has any issue with communication, that can be speaking, voice, or even comprehending what someone is telling them and even giving a response, plus being able to chew or move your tongue and eat or speak. So basically, anyone that has any challenge in that can be helped by a speech and language therapist. So, for example, in children, a child who has autism may have challenges with social interaction or communication. A child who is not hearing can get hearing technology like a cochlear implant or hearing aids for them to hear, and through hearing, then they can be able to learn to speak. Um, Other kinds of conditions in children include cerebral palsy, any neurological condition, Down syndrome, microcephalus. There are lots of conditions, even as simple as just developmental delay. Okay, and some of them are, they have no known cause. A child just is unable to meet their milestones or even perform according to how their peers are performing, can benefit from speech therapy. When it comes to adults, usually adults, we acquire most of these conditions. For example, you can get a degenerative disease that can affect memory or even how you process language, and hence you may benefit from speech therapy. Other people can get a brain infarct. This can be caused by a stroke or accident or anything that hits the head, and thus may have issues with their comprehension or being able to produce sound and speak or even feed. Other conditions in children, in adults, include people who get hearing technology, voice. If you get a voice nodule, or even if you undergo surgery, or even have uh, uh, laryngeal cancer, you can benefit from speech therapy. Apart from that, we always work in a team with other therapists and doctors for us to help this patient either regain a skill or gain a skill that they did not have. Yeah. Otherwise, speech and language therapists really are needed in our communities, and I hope you all can come and join me in this profession. Yeah, it is fulfilling. I've been privileged to work with stroke survivors for some time now. As a speech and language therapist, I have worked with them to help them regain their ability to talk. Um, and that is why I have been able to see the challenges they face as they get to recover or in their journey of recovery. Um, Stroke survivors, one, they get shock or they get a lot of emotions, especially when they realize that they have been handicapped or been made different by the result of stroke. You know, stroke can affect simplest of things like walking, talking, feeding self, dressing. Like you cannot do the things that you take for granted uh, without help or without having to relearn them again. And that can be very devastating for most people. And even apart from that, the high costs of actually getting the care that you need uh, is really, really so much on the family. Um, that is why we recently launched a campaign to help stroke survivors in Uganda. We want to provide the vital rehabilitation services that they need. These rehabilitation services can include physical therapy, speech therapy, occupational therapy, and these tailored therapies help them regain the skills that they have lost in order for them to become independent again, or even be able to enter the workforce and be just like the way they were before. So we want to create a rehabilitation center that one will provide the life-changing therapies. We want to provide support groups. We want to even buy some equipment. That's why we are requesting everyone out there to donate to such a cause. Please help us start this rehabilitation hub that will reach anyone wherever they are in Uganda. We are going to provide mobile therapies and even tele rehabilitation services for those that can, you know, own a smartphone or a smart device. Yeah. So basically, please reach out to us. You can reach out on 0706 105674, and that is the contact you can either donate or contact for more information. Thank you.